I do believe strongly in keeping patients comfortable and not suffering. But I don't agree with, with giving them something that would end their life then. Sometimes in keeping them comfortable, does that shorten their lives? The answer is yes. But my intention there is relieving their suffering, not in ending their life. I don't think that it's right to have a physician, quote, be an executioner or take life. I think the patient should know we're there to help relieve their suffering, but I think that it crosses a boundary when we actually are taking life. If you get down to the practicalities of it, is that most of the laws say, well, if a patient has less than 6 months, that these are things you can do. And I think people need to understand that we as physicians, we're not that good in saying, okay, you have less than 6 months or you have more, how long you have. When patients get down to a few weeks or days, certainly we can give them an idea. But I have patients that I saw a lady the other day was on hospice she's been on hospice for 2 years. And I think and I've had patients that have been on hospice that have come to me and wanted treatment and have gotten treatment, have lived for years. And so I think that my concern is that that people may be given wrong information.
Well, you have intense interactions with everyone that's dying, and you can see the entire range of responses to terminal illness with those patients, which include the emotional components of dying as well as the physiologic components that includes the pain. You see that you need to adapt to every patient in terms of what's required, which is a real task to do. And you have to look at them individually and look at what their needs are, and also continue to feel a support and presence of the physician, which is a major problem with people who die in today's world, because healthcare is so disconnected that commonly the people who are responsible for patients dying have not been the healthcare providers that have been there when they've been enjoying the better part of their illness. And so that connectedness is extremely important with people. And you see occasionally individuals who are suffering so much that you cannot provide them with sufficient pain, medication, or other responses. And so they usually ask the question, do I have to go through this? Is there something you can do? Can you give me medication to stop this? Because the next few days or few weeks of my life are completely intolerable to me. And it seems a realistic request. All you have to do is put yourself in that same situation and understand how would you feel if you were that way. And so it's very, it's not unusual that they would ask for that. In fact, the odd thing is so few people really ask. In fact, in my entire experience of 33 years of oncology in Missoula, I've only had a handful or so of patients who've even asked for support in their dying from medications. One of the reasons why it's nice that we have new circumstances in the state of Montana is that there's a great deal of under-the-table terminal patients dying by taking medications, or sometimes with violence, where they shoot themselves. And I've had 2 of those where they were both rural people, they were both males, they both had terminal illnesses, and they didn't know quite what to do. They wanted to end their lives. Both of them were people that didn't discuss anything with me, but they understood what the circumstance was. And they shot themselves. They came into the hospital being unsuccessful, and both of them died in a few days, and they received maximum care in the hospital because that's what doctors have to do. And when you're caring for people, in both cases, I remember I was nauseous during the entire time because it was a failed attempt at ending their life. They were completely miserable, and all we could do is continue to care for them.
As far as in terms of people with disabilities, historically, people with disabilities' lives are devalued compared to the general population. They're segregated, put kind of the whole out of sight, out of mind kind of thing. And so when you don't value somebody's life as much as, say, another person's that might not have a diagnosis per se, a doctor or somebody might not value or see that person's life as valuable as the next person's, and so might be more apt to say, okay, we're gonna go ahead with this assisted suicide or whatever you want to call it. That's what it is. Even though the person might not be terminal, it might be a serious disability. It might be something that they acquired. For me, for instance, I was in a car accident and acquired a spinal cord injury. The first question I got when I woke up was, do you want to live? I'm still here 10 years later, so obviously it wasn't terminal. And when you start to put something into public policy that has such great areas, I think you're creating I don't even know what you're creating. You're creating laws that can be abused and that can be applied where they probably should not be applied. And so I would say this issue does raise a lot of alarms for me personally as well as professionally in my job.
In terms of my own personal feelings, could I ever imagine a time when I might want to make my own personal choice? Well, of course I can. Do I ever want that to be social policy? Absolutely not. Because we don't have the services and supports that people need, because there is not, there may be the means for adequate pain management, but it may not be accessible to everybody. So that needs to get fixed. Having people be able to have services and supports they need in their own home and not be forced into institutions and nursing homes, that has to happen first. You know, when those things are all equal, then I would begin to look at whether we need social policy or not. But right now, because it puts so many people at risk, particularly people who are low income, people who are women, people who are minorities, people who have disabilities, there's no way that I would want to go around campaigning for a personal right that is going to put so many more people at risk.